And we're going to bring in a medical expert right now to answer the question. Well, we'll delve into a couple of issues surrounding whether or not you should be wearing masks during the COVID-19 pandemic. Friend of the show, welcome, Dr. Yvette Lu. How are you doing?
I'm great. Good morning.
All right, let's talk about this issue with the masks. First of all, if I'm out and I don't have any symptoms, is it a good idea for me to be wearing, let's say, one of those surgical masks?
Well, in the last little while, there's been some concern about asymptomatic and pre-symptomatic transmission. So pre-symptomatic transmission is when you don't have symptoms yet, like you have the infection, but you don't have symptoms yet, but you can still transmit the infection. And asymptomatic transmission is people who have the infection but never get symptoms. And there's a concern that these people can still transmit the infection. So we ask people, if they want, they can put on a mask, and that will help prevent transmission during that time. We don't have a lot of evidence that it works, but it's an option that can help with the spread of COVID-19.
I guess that's tricky because sometimes you could be carrying it, and like you say, you won't know for a couple of days or maybe even a week it starts showing the symptoms. So if you do feel like you are coming down with something, you do have those symptoms, it's going to help stop the spread of germs. Say if you're prone to sneezing, you're coughing a lot, that at least will help it keep some of the germs in, correct?
Yes, that's right. But we ask people if they do have symptoms, like if they feel like they're coming down with something, then they should just self-isolate, because sometimes even when you have mild symptoms, you can spread the infection. So if you think you just have like a mild cold, you should still self-isolate for 14 days.
Okay, it's one thing to
That's the best and most proven technique.
Okay, and it's one thing to actually wear the mask, but some techniques in terms of how to wear it properly, and also, most importantly, how to keep it clean.
Yes, so it's very important to have proper mask technique, because if you don't wear proper mask technique, then what happens is you're going to put yourself at increased risk of getting an infection. So you want to wash your hands before and after touching the mask, because you're touching your face when you put on the mask. So you want to put the mask on, wash your hands first, put the mask on, mold it to your face as much as possible, or else the bacteria and the viruses will get in the sides. And then after that, don't touch your face anymore. Don't adjust your mask. Don't lift it up to eat. Sometimes your face will get scratchy. Try not to touch your mask at all. If you have to adjust your mask, then wash your hands first. And then when you take it off, you want to take it off by the back. So don't touch your mask when you're taking off the mask. Don't touch the front.
But generally, if you had one of those surgical masks, how long should you be wearing one of those? Like a day, or like you don't want to reuse them too much, right?
Those are supposed to be disposable. Like, we don't have a lot of evidence around reusing surgical masks. So that's why we're asking people to wear cloth face coverings. We're asking people to save surgical masks and N95 masks for healthcare workers, because they're at the closest contact with others. They're spending a lot of time in close contact with patients, and they're at the highest risk. So we ask people to save those masks for those people. When you're out in public, you're not that close to people. You should be staying 2 meters away from people. So you don't really need those masks.
Right.
That's why we're asking people to wear face coverings, cloth face coverings, when they're in the general public.
And what other materials could you use for the face covering?
Generally, we're saying cotton, a thick weave of cotton, at least 180 thread count. You can use other materials, but you don't want to use something that's too impermeable, because then you won't be able to breathe through it. But you don't want to use something with too loose of a weave either, because then everything will just get through the mask. If it's too thick, then all the viruses would just go around the edge of the mask. You won't even be breathing through the mask. Some people have been putting filters in between 2 layers of a material, but you have to be really careful, because some filters, especially vacuum bag filters, may have microparticles, microfibers that you can inhale, and that can actually damage your lungs.
Okay, thanks for making those distinctions. And as you close that out, I guess it is important to remember that if it's not a sealed mask, the germs can still get in. I mean, they're microscopic, so people need to be aware of that. The mask will only go so far if it's just the surgical mask.
Exactly. The mask, we don't really have a lot of evidence. So if you want to put on a mask because you feel better, or because you want to protect others from yourself, then that's good. But the most important thing is still physical distancing and washing your hands and staying home, of course.
Okay, great tips there. Thanks as always, Dr. Yvette.
Thank you so much.
Okay, that's Yvette Lu with some great tips on whether or not we should be wearing masks. We'll get this posted online for all you viewers out there. Stick around.